Clonazepam is a powerful medication that is widely used to treat various conditions, but what exactly is it used for? In this comprehensive guide, we will explore the uses, benefits, side effects, dosage, and risks of clonazepam to provide you with a clear understanding of this medication. Uses of clonazepam. Clonazepam, commonly known by its brand names Klonopin and Rivotril, belongs to a class of drugs called benzodiazepines. One of the primary uses of clonazepam is in the management and control of seizures in individuals with epilepsy. Epilepsy is a neurological disorder characterized by recurrent seizures, and clonazepam helps to reduce the frequency and intensity of these seizures. However, the uses of clonazepam extend beyond epilepsy treatment. It is also prescribed for anxiety disorders, panic disorder, and certain movement disorders such as Restless Legs Syndrome. Clonazepam works by enhancing the effects of gamma-aminobutyric acid, GABA, a neurotransmitter that helps to calm the brain and nervous system. This mechanism of action makes clonazepam effective in reducing anxiety and panic symptoms. In addition, clonazepam may be used off-label to treat other conditions such as insomnia, social phobia, and bipolar disorder. It is important to note that off-label use should only be done under the guidance and supervision of a healthcare professional. Benefits of clonazepam. The benefits of clonazepam can be significant for individuals suffering from the conditions it is prescribed for. For those with epilepsy, clonazepam can help to reduce the frequency and severity of seizures, allowing for a better quality of life. The medication works by calming the excessive electrical activity in the brain that triggers seizures. For individuals with anxiety disorders and panic disorder, clonazepam provides relief from symptoms such as excessive worry, restlessness, and panic attacks. It helps to promote calmness and relaxation, allowing individuals to better manage their anxiety symptoms and improve their overall well-being. Clonazepam is also beneficial for individuals with certain movement disorders, such as Restless Legs Syndrome. This condition is characterized by uncomfortable sensations and an irresistible urge to move the legs, typically occurring at night. Clonazepam helps to reduce the symptoms of Restless Leg Syndrome, allowing for a more restful sleep. Side effects of clonazepam. Like any medication, clonazepam can cause side effects. Common side effects may include drowsiness, dizziness, and coordination problems. These side effects are more likely to occur when starting the medication or when the dosage is increased. It is important to take clonazepam as prescribed and to avoid activities that require alertness until you know how the medication affects you. Other side effects of clonazepam may include memory problems, confusion, and changes in appetite. These side effects are less common but should be reported to a healthcare professional if they persist or worsen. In rare cases, clonazepam may cause more serious side effects such as severe allergic reactions, difficulty breathing, or thoughts of self-harm or suicide. If you experience any of these symptoms, seek immediate medical attention. Dosage of clonazepam. The dosage of clonazepam will vary depending on the condition being treated and individual factors such as age, weight, and response to the medication. It is important to follow the dosage instructions provided by your healthcare professional and to not exceed the prescribed amount. Clonazepam is typically taken orally in tablet form. The medication is usually started at a low dose and gradually increased to achieve the desired therapeutic effect. It is important to take clonazepam at the same time each day to maintain a consistent level of the medication in your system. The dosage of clonazepam may need to be adjusted over time based on your individual response and any side effects experienced. It is important to communicate with your healthcare professional and report any changes or concerns you may have. Risks and precautions of clonazepam. While clonazepam offers various benefits in treating certain conditions, it is not without potential risks and precautions. One of the main risks associated with clonazepam is the potential for dependence and addiction. Clonazepam belongs to a class of drugs known as benzodiazepines, which have a high potential for abuse. Extended use or misuse of clonazepam can lead to physical dependence and withdrawal symptoms when the medication is stopped. It is important to take clonazepam exactly as prescribed and to not abruptly discontinue the medication without medical supervision. If you and your healthcare professional decide to stop clonazepam, a gradual tapering off schedule may be recommended to minimize withdrawal symptoms. Clonazepam should not be taken by individuals with a history of substance abuse or addiction, as this increases the risk of misuse and dependence. It is also important to avoid alcohol while taking clonazepam, as the combination can increase the sedative effects and impair cognitive function. Clonazepam versus other anti-anxiety medications. Clonazepam is just one of many medications available for the treatment of anxiety disorders and other related conditions. Other commonly prescribed anti-anxiety medications include alprazolam, Xanax, diazepam, Valium, and lorazepam, Ativan. Each medication has its own unique characteristics and may be more suitable for certain individuals or conditions. Clonazepam is often preferred for long-term treatment of anxiety disorders due to its longer half-life, which means it stays in the body for a longer period of time compared to other benzodiazepines. This allows for more consistent and sustained relief from anxiety symptoms. However, the choice of medication should be made in consultation with a healthcare professional who can assess your specific needs and medical history. They can determine the most appropriate medication and dosage for your individual situation. How to take clonazepam safely. To ensure the safe and effective use of clonazepam, it is important to follow these guidelines. Take clonazepam exactly as prescribed by your healthcare professional. Do not exceed the recommended dosage or take it more frequently than instructed. Avoid alcohol and other substances that can increase the sedative effects of clonazepam. Do not stop taking clonazepam abruptly without medical supervision. A gradual tapering off schedule may be necessary to minimize withdrawal symptoms. Report any side effects or changes in your condition to your healthcare professional. Store clonazepam in a cool, dry place away from direct sunlight and out of reach of children. Clonazepam withdrawal symptoms and tapering off. When it is time to discontinue clonazepam, it is important to do so under the guidance of a healthcare professional. Abruptly stopping clonazepam can lead to withdrawal symptoms, which can range from mild to severe. Withdrawal symptoms may include anxiety, irritability, insomnia, tremors, sweating, and increased heart rate. In some cases, more severe symptoms such as seizures may occur. Tapering off clonazepam involves gradually reducing the dosage over a period of time, allowing the body to adjust and minimize withdrawal symptoms. The duration of the tapering off process will vary depending on individual factors such as the length of time clonazepam was taken and the dosage being used. It is important to follow the tapering off schedule provided by your healthcare professional and to communicate any concerns or difficulties you may experience. Conclusion and final thoughts. Clonazepam is a valuable medication that is widely used to treat various conditions such as epilepsy, anxiety disorders, panic disorder, and certain movement disorders. It offers significant benefits in reducing symptoms and improving the quality of life for individuals affected by these conditions. However, it is important to be aware of the potential side effects, risks, and precautions associated with clonazepam. Misuse or prolonged use can lead to dependence and withdrawal symptoms. It is crucial to take clonazepam as prescribed, communicate any concerns to your healthcare professional, and follow a safe tapering off schedule if discontinuing the medication. By understanding the uses, benefits, side effects, dosage, and risks of clonazepam, you can make informed decisions about your healthcare and work with your healthcare professional to find the most appropriate treatment for your individual needs. Remember to always consult a healthcare professional before starting or stopping any medication.